Good evening, ladies and gentlemen. My name is Monique Delgadillo.
My name is Jessica Iasere.
My name is Lizette Covarrubias.
And my name is Janet Tran.
And today we'll be discussing an exciting new innovation that will benefit people at risk for developing diabetes. Currently, there are many technological products available to diabetics to monitor their health, but there are not many products geared toward pre-diabetics. We are in the process of developing an application that will easily allow pre-diabetics to monitor their blood sugar in a way that's fast and simple. It is approximated that 1 in 3 adults in the US have prediabetes, which is a serious condition that can be delayed or altogether prevented with the right diet and physical activity plan. According to the CDC, people who are pre-diabetic are often asymptomatic, and most are unaware that they are afflicted, and there is not yet a need to manage the complications or monitor daily blood sugar levels. In fact, patients with a diagnosis of prediabetes often go months between in-clinic blood sugar testing as they slowly inch toward a definitive diagnosis of diabetes. Management and prevention, therefore, falls to the arena of personal responsibility and access to pertinent health data such as blood glucose levels. The American Diabetes Association designates the fasting plasma glucose range of 100 to 125 milligrams per deciliter as pre-diabetic. At this stage, a patient is likely to be referred to meet with a nutritionist to discuss a diet and exercise regimen and to return for retesting of their fasting plasma glucose in 6 months. And now I'll be passing it off to Janet to discuss the current trends.
Thank you, Monique. So today I'll be talking about the current trends. In the past 10 years, people diagnosed with diabetes have increased by 32%. Those with higher rates of diabetes are those who are ethnic minorities, the elderly, males, and those who have low social or economic status. In California, 14.4% are men, 11% are women, 10.7% are white, 15.4% are black, 16.2% are Hispanic, and 10.5% are all other races. This shows to tell that the 15.4% blacks and the 16.2% of Hispanics falls under those with high rates of diabetes. According to Santa Clara County website, people who are pre-diabetic or undiagnosed with diabetes in Santa Clara County are 46% of adults, and 62% are adults between ages of 55 to 69, and 65% of those adults are ages 70 and older. So our innovation proposal is an application that can read blood glucose levels to assist pre-diabetics in preventing and or delaying in being diagnosed with diabetes in the future. This application will be a mobile application that you can have on your cell phone, such as an iPhone, Android, or a Nokia, or if you had an Apple Watch that can transmit to your watch. And on this application, it will provide dietary recommendations. It will provide management and prevention. So for example, if an individual drinks 2 bottles of soda a day, that's a lot of sugar. This application will recommend said individual to cut down to 1 bottle of soda every 3 days. This application will also provide information for local nutritionists, or provide information on local nutritionists for individuals to reach out to create a dietary and exercise regimen that's catered to their current health. And now I'll be passing it on to Jessica, who will be talking about the impact outcomes.
Thank you, Janet. So our main goal here is to have the best possible outcome for individuals to live the most healthiest lifestyle that they can. So we want to reduce the rate of diabetes by 25%. It will improve lives, promote healthy diets and healthy lifestyles, and it will encourage people to be more active. The most important thing is statistically improving individuals' A1C levels. So for leadership and staffing, just like the outcomes, we want the best possible leadership and staff people so we can get this innovation going. So we chose the American Diabetes Association because they provide programs and resources to help those with diabetes. Also for our invention, people invest in research. We want people to help invest in research aiming to prevent people from getting healthcare issues beforehand. Also, we would like Sir Frederick Grant Banting, a Canadian medical scientist and doctor, and also he is the co-discoverer of insulin. He may take part in the invention with other doctors, nurses, and other staff members. The research is supposed to be for type 2 diabetes and complications of diabetes as well. Now, I'll be passing it off to Lizette.
Thank you, Jessica. No. So just like how Jessica mentioned, we will be reaching out to the American Diabetes Association for their assistance and for their resources. They have a list of supporters that have developed medicines and devices to help individuals with diabetes. Wait, we have to try to start over again.
No, we're gonna cut it out. Just go.
You can edit it.
Yeah, just go. So start from the top.
Okay. Are you sure?
Just ask. Yeah, just go. Just ask.
Okay. So just like how Jessica mentioned, we will be reaching out to the American Diabetes Association for their assistance and for their resources. They have a list of supporters that have developed medicines and devices to help individuals with diabetes. Also, we will be communicating with many different companies such as Apple and Android to make sure that devices are compatible to the device we want to invent. In addition, we will also need to be in contact with engineers, hospitals, and nonprofit clinics to help build the device and to help distribute it. We want to introduce to the market an app that works with wearable technology, such as an Apple Watch. At the moment, my Apple Watch reminds me when to stand up, drink water, breathe, and relax. Just like how my Apple Watch can read my heart rate, this innovation will be able to read individuals' blood glucose levels and give dietary and physical activity recommendations to help keep blood sugar levels in a healthy and stable range. We will need the full $1 million to fund the research, pay for the device, and pay for staffing that will be helping out, as well as the participants who will be participating in the trials. In conclusion, diabetes seems to be a huge health issue in the United States and will continue to be on the rise. A high percentage of people in California and in the United States are currently pre-diabetic or diabetic. The purpose of our innovation is to provide people with access to a device that can be fast, accurate, and also affordable and pain-free. In the process, we will include companies and medical professionals and other staff members to contribute to our innovation. Overall, our goal is to prevent people from developing diabetes through our invention that will be able to read blood glucose levels and give diet and physical activity recommendations. And that concludes our presentation. Thank you.